So I'm Anna Cleminson. I'm a consultant in palliative medicine and I work here in Sligo, Northwest Hospice. We are based right next to the hospital. As a service, we have 8 beds in the hospice, and in this area we're able to provide care for people with very specialist needs that need focus. But we also look after people in the Sligo region, and we have a community team that work from this building and go out and see about 100 patients. Over in the hospital, we often have 20+ patients that we go and see, and that allows us to seamlessly provide care in whichever area people are living. What we're trying to do is enable people to live the life that they want to live at this period of their life. Recently, we've had people who found that this place, the hospice itself, is a very secure and safe place, a place where they can rest from the chaos or the noise and the activity of life, and they're able to gain strength and then go out and spend time with their family with the energy that they've had from staying here. So we can offer sanctuary and support. So I think patients that are good examples of what palliative care can do are ones where we enable them to live as they want to through this period of life, and that can be in really different ways. We had one man, he was a rascal, he was lovely, he was full of devilment, but the most important thing to him was his 13-year-old dog. It was a big dog, and the only thing this gentleman wanted to do was go home and be with his dog. And so what we did in here was we worked with him so that he could be as good as he could be. We then worked with the people who support him in the community so that he could go home, and he was able to live out his life in his flat with this huge dog, and his family also was supportive because the dog needed walks and things. We had another man who was in here. He was really into photography, and while he was in here he was thinking about different projects that he could take pictures of the hospice that didn't show patients but represented the hospice to him. And it's facilitating him to keep going and doing those activities. And we did that partly through managing his symptoms, and partly through just listening to him and facilitating what he liked to do. We had another gentleman who was really into his gardening just recently, and although he was a patient here, we were trying to encourage him to build up his mood, and actually he ended up doing our own garden. So he went out and helped dig some flowers for us. And he actually enjoyed a wee fag, so he got to have a wee smoke at the same time. And while usually as a medical profession you would say that was the wrong thing to do, actually it was important and it was part of his enjoyment. And I think that's the focus. How can people live this part of life in the way that they want to? I think people imagine that palliative care is a time of sadness and of doom and of gloom, and undoubtedly there are sad moments. But with the help of the team, we help people to do what they want to do. We enable them to live life in a way that they want to, and that even there can be times of growth and light within the family and themselves, which is really important.